Should be recording. I didn't get my original record message, but maybe that's because we were already recording for AI notes. Good afternoon, everyone. I'm Beth Wallace. I'm the Director of Engagement for Vermont AEYC. We are so pleased to be co-hosting this bi-monthly Q&A with our friends and experts, Dr. Breena Holmes and Dr. Becca Bell, and our friends at Department of Health, Julia, who will take over facilitation here in a moment. We have collected questions ahead of time for folks, for our experts to weigh in on, but we also have the opportunity for you to ask questions that are popping into your mind right now. So be thinking about that. And with that, I will turn it over to Julia.
Everyone, my name is Julia Saracen, and I am the Vermont Department of Health Childcare Health and Safety Consultant. I'm here with my colleagues from the University of Vermont Medical Center and Lardner College of Medicine, pediatricians Dr. Breena Holmes and Dr. Becca Bell. We're going to start our time together today with a 30-minute Q&A session, followed by a structured content presentation. Our structured content section will start at 1:30, presented by our guest speakers, Hilary Fannin, John Davey, Katie Marin, and Megan Carey from the Health Department's Division of Laboratory Sciences and Infectious Disease. The content will focus on viral respiratory illness and vaccine-preventable diseases. But before we get into that, we are going to go over some of those pre-submitted questions. So my first question is for Breena. Hand, foot, mouth cases are at an all-time high in the US. We have had some children get it 3 times over the summer, despite our extensive hand washing, cleaning, sanitizing, disinfecting, etc. And parents are becoming frustrated. Do you recommend more strict exclusion than what is in the childcare regulations?
Well, first of all, I can never gather in a group like this, hi everyone, without acknowledging what strange and difficult times we are in. So I'm not a good person for just business as usual. And so I just wanted to say that, especially when I see so many of my health department colleagues on this call, and just acknowledging that the uncertainty and the challenges we face, we just want you all to know in public health, we see you, and we appreciate your effort to still get up every day and keep working in this space with us. Hand, foot, and mouth is just a bear. It's a very well-known, easy to transmit virus that morphs all throughout a season. So there isn't any, you get it once, you're protected. You can get it many, many times. The good news is that as you get older, when you get it, you get milder and milder cases just based on your immune system's response and the exposure. So no, there isn't anything beyond the normal advice about this. And I just want to acknowledge, as childcare providers, I know you do incredible work in sanitizing, hand washing, infectious disease prevention. So I think when parents feel that frustration, you can just assure them that you're in close contact with pediatric teams, and that they should also talk with their own physician about what they think might be going on with a child who may be seeming to get it frequently. Obviously there are other viruses that do get mixed up in this big mess that can cause fever. Not so many cause that characteristic vesicular, blister rash that gives it its name. But I did want you to know that you're doing everything right, and that it just exists in this form in our world. But the other thing I would also really make sure people understand is that we don't really like to attribute and blame things on each other. That was one of the big lessons of COVID, as we started doing all that contact tracing, and people were very much like, we got this from Johnny. And I think in hand, foot, and mouth in my career, I've seen that a lot, that there's a lot of attribution and blame to the source of the infection. And so if there's any way you can curb that, it's certainly pervasive, and it's not always exactly the kid you think that's transmitting, especially because the transmission is really when you're hot, hot, hot with fever. And sometimes kids, they're not recognized as being in a fever. until like later in the day or the next day. So I'm happy to answer questions about that offline as well, because I think it makes your day hard. And I'm going to end, as I do with everything about infectious disease, that I think the partnerships between you, local pediatricians, and um, the parents is kind of the interesting space here. Lisa, I'm seeing your question, hand, foot, mouth, and pregnant people. And maybe Becca can help me with this as well, or I can get back to you. I don't know. That's not a familiar virus to me in adult in pregnancy. And being in contact with someone with hand, foot, and mouth is not a risk to pregnancy from my brain, but I'm going to double check that before the end of this hour.
Just want to give some space for anyone else to ask any questions or for Dr. Bell to expand upon that. I am seeing a question or comment in the chat that says regulation only states to exclude children with mouth sores and excessive drooling other than the normal exclusion. So if children only have blisters, they don't need to be excluded. So just some clarification on that.
Yeah, that sounds right to me. I mean, the true exclusion criteria should be around fever and returning when the fever is gone 24 hours. And then I did, in prepping for this question, I did notice, I mean, one of the things you've also taught me very importantly is a child's ability to participate in the day. And I think the sores are very painful. And one of the highest risks of this virus is dehydration. So again, if you can't adequately hydrate or feed a child in your care, they shouldn't be there. And I did just find my OB Google that it is safe. The exposure in pregnancy is not a risk to the pregnant person.
Like we lost Dr. Bell. I'm going to keep an eye out for her rejoining. She may have lost service.
And we have some follow-up. Breena, you hearted it. Yes, always fever and ability to participate. We have found that if they don't have most sores, but have sores on their body, they act fine a lot of the time. So once again, I do want to give folks a chance to ask any live questions, either by putting in the chat, you can raise your hand or come off mute. And if not, we can get started on our structured content early. So we'll give it a couple seconds for folks to ask any final questions.
I have a question. Can you hear me? I don't know if there's an answer, Breena, to this, but vaccines. Do you want to talk about? I'm just curious about access to vaccines
Yeah.
for adults, like parents of Medicaid vaccines, all that goes together. Do you
All
want
the
to?
hard stuff.
Can you just give us a crystal ball and tell us what's going to happen?
Well, first of all, hi, Stacy. So
Hi,
nice to
Breena.
see you. I miss you. So that's part of the reason the health department team is on today. I mean, what I think Julia is going to take us through is, maybe I'm wrong about this, so correct me. There's official answers and then there's Breena editorializing. That's always our balance on this call, which is good because I don't work for the state of Vermont anymore. So Julia, how were you planning to handle what's not really answerable, but I can certainly hypothesize with Stacy. When would you like to do that now,
So
or?
we have space to hear the opinions of all of our experts and professionals on the call. We do have our vaccine team and our vaccine preventable diseases team, respiratory illness team We have a lot of very intelligent folks from the health department here today. They have received all of the questions ahead of time.
Great.
So
let's have them answer sort of where we find ourselves at 1:11 p.m. on September 11th. And then I will tell you what's going on from the sort of American Academy of Pediatrics policy perspective. Let's do it in that order.
Since we're getting an early start, we can go through their presentation and then have a good chunk of time at the end to recap and also to ask additional questions.
Great.
Okay, so next up, we have our folks from the Health Department's Division of Laboratory Sciences and Infectious Diseases presenting on viral respiratory illness and vaccine-preventable diseases. We've received several questions on vaccines, flu, and COVID, and we hope to address them during this session. As I said, please feel free to continue to ask these questions in the chat and after the presentation.
Great, thanks so much. And Julia, could you just let me know, are you able to see the title slide and the proper? Excellent, thank you very much to Breena. So good afternoon. Thank you so much for having us join your call today. We really are very pleased to be here to just chat a little bit about fall respiratory illness, as well as just kind of looping in some of the other vaccine preventable diseases that are common in your space and just might benefit from getting some recommendations altogether for all of these. So I am Hillary Fannin. I'm an infectious disease epidemiologist. I work with flu surveillance as well as vaccine preventable disease surveillance. And I'd like to introduce my colleague, John, to say hello.
Hi, I'm John. Appreciate being here. Appreciate Breena's introduction as well. I coordinate the COVID-19 EPI program and work with Hillary on vaccine preventable diseases.
Excellent. And Katie, would you mind hopping on to say hello?
Hi, I'm Katie McCurran, she, her pronouns. I'm with the immunization program and I'm one of the nurses there. I am primarily going to be here to help with Q&A support, but thanks for having us. Excited to be here.
And last but very much not least, Megan, could you also say hi?
Hi.
Oh,
hey, everyone. Thanks for allowing us the opportunity to join you on today's call, and we look forward to answering your questions. My name is Megan Carey, and I am one of the nurse coordinators with the department as well. I work alongside Katie, and my primary focus is on child and adolescent immunizations. We have a lot of content. I can't say a lot, but we have a decent amount of content regarding what to expect the immunization outlook to look like. And I'll just kind of put a disclaimer on it. I think we might have already done that. For some vaccines, specifically one vaccine, it's a little bit unclear. We'll get into that though. Thanks for having us.
Wonderful. Thanks so much. And I think I'll be able to see hands raised if there are questions as we go, or if we just want to collect them all for the end, whatever works best for folks. I am not offended to be stopped. So feel free to interrupt me if you have any questions, thoughts, clarifications. So basically just wanted to go over some high level recommendations first. I know we've got questions on the mind, but wanted to provide some resources all together just to have available, especially if folks are new to the space. What kind of recommendations do we have from the health department about viral respiratory illnesses and vaccine preventable diseases? So vaccines are the best tool for prevention. And of course, there are other things that you're all very well versed in and expert at of, cleanliness, hand hygiene, really paying attention to all of those really important procedures. So really one of the prevention steps is just making sure that your policies to prevent illness for communicable diseases, some of which are these vaccine preventable ones, all of those policies are really up to date and people know where to find them if they need them. Ahead of the fall season is a good time to make sure that the ducks are in the row here. So it's available before you need it, not as you need it. And if you have any questions about some resources that would be good to include in those, we've got a slew of information on that, as well as I'm sure items that you've heard about on these and other calls in the past. And so just another really great thing about all of these cleaning strategies is they're effective against a lot of these different things that can make people sick. Practicing good hand hygiene is really high among them. And so if there are staff or children who have symptoms of any of these conditions, I'm not going into great detail about symptoms or what diseases are on this call. I would love to come back and talk pertussis in depth if you'd like me to sometime. But if there are folks who have symptoms of these illnesses, and like Breena was talking about earlier, if there are kids who are presenting and you're not able to care for them in the child care setting, make sure that there is a plan and a policy in place for what to do if staff or kids have symptoms. And if you do hear of reportable illnesses through caregivers, so, say somebody says, I'm keeping my kiddo home because they have chicken pox, it is appreciated by us if you're able to let that guardian know, like, hey, has the primary care provider reached out to the health department on that, just so that we make sure that we are aware of these cases. They are all reportable. They should be being reported by the primary care provider. But if it's something that is easy to include in that conversation, it really does help make sure that we're identifying people who are sick with these illnesses where we have recommendations from public health to stop the spread of illness. So we do have our list of reportable illnesses here. It's searchable on our website. So that's something that is helpful to know. And as early child care education centers, you are not a required reporter as that kind of a facility. This is just presented as sort of interest for you. And if you are able to make an outbreak or a report, that is something that we really appreciate and do look forward to working with folks if they are experiencing a reportable illness outbreak to walk through that process. So happy to talk about that a little bit later. I'm getting ahead of myself. And if you have any questions or concerns at all ever about these reportable illnesses, we're available to chat with you, either us at the central office or our colleagues at the offices of local health. I've got a link to the Office of Local Health Finder here. You type in what town you live in, it gives you your local health office. And we're able to connect to resources and just provide information. Each of our offices has a copy of the American Academy of Pediatrics Purple Book, which is an awesome resource. So if you don't have one and you're looking for a chapter, we're happy to help you with that. And I do have a couple of our email addresses. I did not include the COVID one here. I'm sorry, John, that was an oversight on my part. But we've got the vaccine team and the flu surveillance team emails here. And with that, I will pass it over to John, if you would like to give any context to details about outbreak reporting that I haven't spoken about.
Sure, thanks. So as Hillary mentioned, early childhood education facilities aren't required to report diseases such as COVID. Schools are required to, so we'll often have a sense of what's going on in the sort of childhood community in the area. So please do feel free to reach out to us as a resource. I'll share our email as well, but really with early childhood education, we're really here as sort of a bonus resource for you to reach out to if you want some assistance. That being said, I think from our perspective, what we'd really reiterate is what Breena mentioned earlier, which is really be in coordination with local healthcare providers, health centers, be that point of communication with families and healthcare providers to the extent that you're able to and that works for you. We don't have specific COVID protocols anymore. It's one of the few sort of bits of good news we got out of COVID in our history of the disease is while there are populations at heightened risk for bad outcomes with COVID-19, which is why vaccines and hygiene are so important, children aren't one of them. The pediatric population is not at heightened risk for COVID-19. Our email is here. I'll also pop it in the chat where it's a nice, easy link. But basically with COVID, we want you to treat it the same way you treat flu, other diseases. If the kid's too sick to be there, if there's a fever, the kid shouldn't be there. We can move on from this slide, Hillary.
Great, thanks, John. And here I just have, building on that, what our parameters for flu outbreaks are for folks who might be new to this space. And the same rule applies that I was mentioning, and John mentioned that this is not a requirement to report, but should you wish to, these are the parameters. I won't belabor them. I know it's very text heavy. There are kind of two different types of outbreak definitions. There's influenza-like illness. The main difference here is just one has a test component and one does not. So the influenza-like illness, there does not need to be evidence of influenza, but there's this respiratory illness that's definitely of concern. And so it gets reported in that kind of container. And then the flu outbreak does involve verified influenza. And just some sort of like percentages of, we have school here, but the facility, the total percentage that we consider, concerning to be outbreak level. But there's flexibility here. If you have concern, reach out. We're happy to talk. And I have the link here to just our flu outbreak page where all of this information is. So we won't spend any more time looking at all of this. And then for vaccine preventable diseases, I failed to mention that at the header of all of these slides, this outbreak reporting link is our online reporting tool, which has been in place for about a year now, I think, for folks to be able to report these illnesses to us online rather than having to call in. So, so far we've been hearing it's been working pretty well, but if anybody has feedback, please let us know. So common reportable vaccine preventable diseases, we've got pertussis or whooping cough, which made a big comeback last year and has not really left. We're still seeing sporadic cases of pertussis since about last August to now. And then chickenpox or varicella. So those are two common reportable vaccine preventable diseases that we hear kind of throughout the year. Less common, but very important to be aware of: measles, hepatitis A, and mumps. And there were some great measles checklist resources shared by the CDC recently for specifically early childhood education settings, where there's just sort of like the first 5 minutes, if I have a concern, what should I do? It's a great resource to have on hand. Okay, so that's just sort of like the overview of our recommendations. And now we're just kind of going into a little bit about what's going on with viral respiratory illnesses. And again, take it away, John, if there are no pressing questions. I don't think I've seen any.
No? Okay, great. So the overall level of acute respiratory illness right now in much of the country is low to very low. We're not seeing influenza or RSV show up yet, as Hillary can explain better than I could. I believe typically it starts earlier in the Southeast United States before making its way to the rest of the country. Don't believe that's occurred yet. We in the U.S. in much of the U.S. outside of Vermont, we saw a late summer increase in COVID-19 activity, and we're starting to see a bit of an increase in COVID-19 activity. Don't worry, there's not a new COVID out there of significance. There's always new strains, but we nationally, it seems like it may be leveling off, although in much of the US, we're still seeing an increase in COVID-19 activity, such as in Vermont. We can move on to the next slide. And so we do see it is, it's declining in parts of the country. It's growing, likely growing in other areas of the country. We are seeing it tick up in Vermont. That being said, by the standard of our history with this disease, it's still at a pretty low level of activity right now. That isn't to say there aren't many people in Vermont being sickened and even more inconvenienced by COVID right now, but we don't know if this portends an ongoing, continuing increase. We don't know if this is going to be the year that COVID starts to look more like flu and other common respiratory illnesses in terms of seasonality. As folks might recall, and as the numbers kind of show here, we've sort of tended to have sort of two spikes per season. We've seen a spring or early summer spike followed by a fall or more typically winter spike. We don't have the information to predict what's going to happen. I think overall CDC is projecting a similar year like last season with COVID-19. It could get better, could get worse. We're going to talk about vaccines later. There's some real challenges on that front in terms of vaccine availability and promotion in the United States. That being said, there wasn't not tremendous COVID vaccine uptake, even in Vermont last season. So the epidemiological impact of this is yet to be determined. All this is to say is that, yes, we are seeing a little more COVID-19 activity right now. If you think you're seeing it, it's not your imagination, but we are still relatively low compared to where we've been for some questions about variants. The thing I'll say is there's actually every once in a while there'll be news stories about a new named variant and some anecdotal observations about symptomology. We don't really have the data to show whether current range of variants are associated with a particular new set of symptoms. Basically, in our populations that we're talking about, it's going to be pretty similar. A lot of low symptom level COVID-19, sniffles, cough, fever. We will see fever. We will see headaches. We will see sore throats. There is still some indication that loss of taste and smell may be more likely to occur with COVID-19 than with other disease, although I do think that more recent variants have been sort of less associated with dramatic differentiation between COVID and other coronaviruses and other so-called cold and flu viruses. So nothing alarming to report, no changes for what we want from you folks or for you to keep an eye on. Again, vaccination, hand hygiene is important. Keeping kids who are too sick to be outside of facilities and schools and daycares is the name of the game here. So thanks.
Thanks, John. And I'll tag on that. I don't think it'll be a surprise to anyone in the room that last season was a big flu season. There was a lot of flu illness. So it was the highest nationally severity flu season since before the pandemic, since the 2017-18 influenza season. So we really are encouraging folks to get the influenza vaccine. It's available. I heard on a call this year for the first time, you've probably all heard of, but flu before boo, which is a reminder to get a flu vaccine before Halloween. I really thought that was endearing, so I would share it. And yeah, just even if somebody does get the flu, it's been shown that the influenza vaccine reduces the severity of illness. So it's just a really great step to take to prevent people from severe outcomes of influenza, which soberingly, it was also a very high pediatric mortality season for influenza. And so just any steps we can take to avoid that. Over 90% of those cases were unfortunately under-immunized. So just a sobering information to share about that. And also about influenza A last year, we were getting a lot of reports, including from early childhood education centers, of there being gastronomic involvement with influenza. And CDC did release a little article showing that, that was nationally shown last year that influenza A had some gastronomic involvement. So I will go ahead and get that link to Julia in case anybody's got some academic interest there. But I can move on to what folks want to hear about, and that is the vaccines. So I will just put up a few helpful links on a slide here and hand it over to Megan.
Awesome. Thanks so much. And I'm looking at the time and just thinking sometimes my network gets a little bit weird around this time. So I'm going to keep my camera off until the Q&A because I don't want to drop on the call. But you can go ahead to the next slide, Hillary. Thank you. Oh, you know what? Do the animations work in this? Will they work? Oh, okay. You can go ahead and just click through them all. It might be easier. So, of course, we heard that you all wanted to learn more about the outlook for our respiratory virus vaccines for this season. Of course, a really hot topic this time of year and one that we have been speaking to quite often. So today I'm going to be discussing RSV, influenza, and COVID-19 vaccines with you. And of course, with the first one being the outlook for RSV immunizations. So I just want to point out that for each respiratory virus vaccine antigen, we have like this little summary or scorecard to share with you that summarizes what to expect for each vaccine for this season. And this is, of course, the RSV first starter. Usually you'd have really cool animations and I'd go through one by one and explain it, but I'll do it verbally. So there's 3 RSV products available for this season. There's 2 monoclonal antibodies, so that's going to be nirsevimab and clesrovimab. Clesrovimab entered the room earlier this year when it was approved. I don't think it's widely available. We'll kind of get to that in a moment. So it's something that's still sort of new and we're working to get it in, but it is going to be an option. And then, of course, the RSV vaccine for pregnant individuals, which is going to be a Brisvo. So you can see all 3 of those on the slide. In this first column, we have a battery icon that indicates immunization supply. So for RSV, we are good to go with the Brisvo and nirsevimab. We do not anticipate supply issues for either of these products this season, which is really great. We do have this cautionary yellow question mark for clesrovimab. We haven't heard of any specific concerns around national supply, but we did hear that we might see some smaller supplies as we sort of ramp up production, similar to what we saw with the rollout of nirsevimab that first season. So again, we just had this yellow cautionary, like, yes, we're going to have it. We don't know when, but it will arrive at some point. So that's really exciting. For the second column, we're looking at whether the product will be available through the Vermont Department of Health's state immunization program for enrolled providers. So this is also known as the VVPP to many of you, or if like VFC program, VFA program. And we're happy to report that a Brisvo and nirsevimab are already available to order, which is really exciting. This means that providers enrolled in our vaccine program can order them and begin administering when those administration windows open. I didn't go into a whole ton of detail on these slides, but I'll just note that for Brisvo, this is September 1st, so we're already underway with giving that vaccine. It can be administered now. The window has started. And then for the monoclonal antibodies, that seasonal window is going to open up on October 1st. So we want to just let you all know that you should not wait to administer nirsevimab if you're going to give it. Don't hold off and wait for clesrovimab supply to come in. CDC is really encouraging providers to administer nirsevimab if that's what's available. And eventually, once we get clesrovimab in supply, things might shift a little bit. But don't hold off. Go ahead and give those now. They're really effective.
Megan, can I just interrupt?
Yeah.
I'm so sorry to interrupt. I just wanted to give everyone just like a broad overview of what this is. And I do think that what we're really looking for from our early childhood educator partners is to just tell people that this is available and that they should talk to their pediatrician about it. But I think sometimes like knowing that there are a bunch of products actually can seem overwhelming and confusing. So I just wanted to start like so broadly to say that again, as an overview of RSV, respiratory syncytial virus, the most common reason for kids to be admitted to the hospital, super, super common. We have these extremely successful immunizations now, and it worked so well last year. Just to give everyone the clinical context, kids did not come to the hospital. They did not get admitted if they got one of these. And so the 2 options are the pregnant mom can get, that's the Brisvo, the vaccine. And the way that works is during a certain point in pregnancy, and it's available now. If they can get the vaccine and then they make their own antibodies and they pass it on to the baby. So when the baby's born, they have some protection, or they can get nirsevimab, which is the monoclonal antibody. And that's just, you get the antibody and it can work right away. And so babies can actually get that in the hospital starting in October or at their pediatrician's clinic for anyone under 8 months. So I think I just don't want people to like get too down in the weeds with it, and we can give lots of information, but I just want to also add it worked so well last year that we want to let people know that RSV is around the corner and that they should be thinking about getting the immunizations, either get it themselves if they're pregnant or get their infant under 8 months starting in October. So I just wanted to sort of set the stage there.
Yeah, thank you so much, Dr. Bell. And just to piggyback on that, there is no preferential recommendation for one of these RSV monoclonal antibody products over the other. They're both very effective, as you mentioned. And so I think the importance is just getting that immunization. It was really successful across Vermont. So that is definitely the message here. For that third column, we have a clipboard, and we're reporting on if there's an ACIP recommendation in place for this season. And for all three of these products, we currently do have ACIP recommendation and approval. So that's great. This last column is for insurers and whether there's concerns with insurance reimbursement for administration. And we don't have any concerns for these products listed on insurance reimbursing for them, which is really awesome. And you can move to the next slide. This slide's a little bit faster. We're moving on to influenza. Our outlook is looking really good. Everything is green and it's good to go. We have no indications of concerns in national supply. We do have flu vaccine available to order through the Vermont Vaccine Purchasing Program. We have, that ACIP recommendation, and we do not have any concerns on insurance reimbursement for this year. We have actually heard from quite a few people in the community that they've already received the flu vaccine for the season. So we do anticipate that teachers, students, providers, sort of anyone who's looking for these immunizations, the flu vaccine specifically, will be able to access it through their provider office or through pharmacies without difficulty. And of course, just kind of touching back on what Hillary said around the importance of getting the flu vaccine, before October, the end of October. The Basically, we're recommending that people get vaccinated before flu activity increases, as it does take a few weeks for the body to build that full immunity. And the ideal vaccination window is September through the end of October. So really fun. Go ahead to the next slide.
Sorry, I missed those animations. There we go.
No worries at all. All right, so this is the topic of the hour. So the next outlook is for COVID-19 vaccines. But before we jump into the scorecard, it's really important to provide some background. So just hang on tight for a second. The Advisory Committee on Immunization Practice, also known as ACIP, you may all be familiar or perhaps not with this committee. They're a committee within the Centers for Disease Control and Prevention that provides guidance on the use of vaccines in the United States. So basically, they develop recommendations on FDA approved vaccines and immunizations. They come out and they say, okay, this is the recommended vaccine schedule. These are the dosages. These are the contraindications, sort of for all age groups. So really important committee. Historically. Recommendations are voted on by this committee, and if they're approved, they would then go on to be signed by the CDC director, which puts them into practice. And what that means for all of us is that these recommendations have a really big impact on our state laws, and they are linked to insurance coverage, as most insurance plans are required to cover recommended vaccines at no cost to the individual. So all of that just to say, ACIP has not yet voted on the recommendations for the use of the 25-26 COVID-19 vaccines. So last year, we saw the ACIP make votes and have discussions on the vaccine in June at the June ACIP meeting. And this year is not normal. It's not business as usual as we started this meeting. It's very different. And I think we're all feeling the impacts of the delayed recommendations personally and within the community. So just to say that ACIP is scheduled to meet on September 18th and 19th, and we do hope to have a clear outlook then. We're not really sure exactly what that's even going to look like because they've really kind of pulled in some of the guidance already. So for now, hopefully this isn't a major surprise, but the outlook for COVID-19 vaccines remain largely unclear because we don't have those recommendations. So we're going to give you what we do know, and we hope to hear more. But we aren't hearing of any supply constraints for the 2025-26 vaccine. So we're looking at that battery column there. But we do know that for the youngest kids, there is now one less vaccine option on the market with the recent removal of the Pfizer vaccine for those under 5 years old. We do want to let all of you know that the CDC indicated that they have been communicating with Moderna to ensure that there is additional supply available through CDC contracts to make up for that removal of the Pfizer vaccine. So hopefully this will allow children under 5 to have continued access to COVID-19 vaccines. It'll just be the one option, but hopefully it remains without a problem and access will be adequate. I just also want to mention that most providers do not have the 2025-26 COVID-19 vaccines available unless they've private purchased for a specific age group. They wouldn't have the vaccine available through the state program. We currently do not have supply of that vaccine to distribute to practices. So we're just kind of waiting on that recommendation to figure out what all of this looks like. And then moving into the next column, we don't know what community access will look like. Actually, I'm jumping around a little bit. Let me take a step back. We don't know what community access is going to look like in terms of like private supply at provider practices, whether or not they're going to choose to private purchase vaccines for that 65 plus age group or not. And even sort of at pharmacy access, it's sort of up in the air. This week, we did hear some good news that some pharmacies are already administering the COVID-19 vaccines. Of course, they don't order them through CDC contracts, so many pharmacies have them in stock already. But we have heard of a barrier that for some pharmacies, they're requiring prescriptions while others are not. And this is sort of a completely new concept. So something that we haven't really encountered a whole lot in the past. And while we wait for those recommendations to come in, I think we're just going to continue to see difficulty in people accessing this vaccine. So what we want to say is that we anticipate having the vaccine through the state supply for providers to order and stock at their practice. We just don't know the timing of when it's going to be available. And then for clinical recommendations, as we kind of talked to at the start of this slide, we don't have these right now from ACIP. We have some clinical recommendations from professional organizations, but we're really sort of in a waiting game for those ACIP recommendations to fully understand what the impact of the ACIP recommendations might be overall. So finally, that last column, billing can be tied closely to ACIP recommendations as mentioned. And so federally, insurers are required to cover ACIP recommended vaccines. And the Vaccines for Children program does provide funding for vaccines that are recommended by ACIP. So this is kind of the quick outlook summary of things. And that is all from me. I would anticipate there to be questions.
Yeah, thank you, Megan. And I think that would be great to kind of go into that second question to make sure that we've got this covered before maybe we open the floor to Breena to put her 2 cents in as well. But what vaccines will be available for children and teachers in terms of COVID, flu, et cetera. I think that was what Megan went over pretty extensively there. But are there any lingering questions about that presentation that anybody has?
Well, this is a good time for Becca and Breena to weigh in that, okay, so this whole ACIP thing is the inflection point on the 18th and 19th of September next week. And it's very important for me to state in this public meeting that the ACIP was in previous iterations was full of trusted colleagues of pediatricians all over the country, people we knew their names, we knew them personally, we were trained by them, they were ethical scientists, and that this new group is loaded with people who have been very vocal about non-scientific and anti-vaccine stances. So I have no idea what's going to happen next week, but I will tell you that Vermont is planning, and Becca can speak more to this, big press conference next Friday afternoon, which will be our best attempt to respond to what transpires in the 36 hours prior to that. And in that space, we will try to wonder together about what Vermont is going to do. So Beck, I don't know if you want to say more about that. I
Yeah.
did put in the, oh, well, you weigh in now and then I'll talk about the schedule and what we believe.
Yeah, I think do we have more slides, or if not, maybe we could put them down just so we can
Oh,
see people.
yeah.
Sure.
It's
I
okay
do
for
have
them.
one more thing, but
Oh,
I
okay.
can pop that back after.
Oh,
No
okay.
worries.
So I think this is what I always tell residents. We tell residents when we're teaching them like a ton of medical information is for them to learn some of it, but then for them to know where to get the correct information, because information might change and right. So like part of like learning medicine is learning like where are the sources and who do you go to. So you just got a lot of information, but what Breena and I want to say, and we are free to speak on behalf of ourselves and say whatever.
Yes, we are.
I'm just making sure everyone knows that. Is that you and the families that you serve want to know where to get information. And so Breena put in the chat the healthychildren.org, which is the American Academy of Pediatrics. That's the pediatricians of this country. It's where they have great information and they've ramped up their communication. So they are very timely with all their information. I'm going to put in the chat. They have also have a number of pediatricians that put out frequent, good, excellent, timely information on social media. And I'm going to give you all that list. You can share that with families. And so you're hearing a lot about like this meeting next week. And I think instead of needing to know the details of it, it's like, who do we turn to? And so what Breena and I and other pediatricians are worried about is that the recommendations coming out of ACIP, we're being told by people who worked at the CDC before that it's not going to be accurate, but there are other places to go to. And so the AAP is a great resource, and we're going to give you that information so that that's like always something that you can look towards. Vermont Department of Health has great information, accurate information as well. And so we are sort of anticipating that there may be some confusion after this meeting next week. And I just want you to know that there are and you can always email us too. But that's just an easy way for you to look, for you to know for yourself, and for you to share with families, and maybe even send some of those resources out in your communications with families. Like say you do it this week or next week might be useful, because there might be a lot of like confusing information coming out next week. So I just want to let you know that although there's a lot of uncertainty, there's a lot of good, really good, accurate information being put out there if you know where to look.
Yeah, and I also, because you're all so beautifully tuned into the social emotional health of your families, the part that works best for me in Vermont is how much we care about each other. And there are children in this state and in your care that are very susceptible to infectious disease and are very frightened about the potential lack of protection of the community for their own children. And I bet you know some of these families. So that was something that just came to light today in my frequent conversations about how on earth we found ourselves here. This is affecting some people more than others already, in that deep fear about children with special health needs. So that is your daily life. And so I think Becca and I really feel this feels very COVID pandemic-esque to us, that all of a sudden we're in that state of not knowing, like we were in the spring of 2020. And so the only thing we know to solve that is community, is trusted experts being available to each other, and not overloading our brains with things we can't vet, you know? That's Becca's point, is how on earth are we supposed to make sense of all this? And Stacy, thanks for leading us with that. I mean, just so you know what's going on with your pediatric colleagues. So people are already being asked to administer vaccines by families that is not currently the FDA approved schedule. And that puts pediatricians in a very tough spot, because they know what's right for kids. And yet they don't have the same North Star. They have the AAP, but it used to be that the federal government was a place to go for that guidance. So it's a shifting sand. And we are so grateful for the American Academy of Pediatrics. I can't even tell you. You know, they've always been a wonderful member organization that advocates deeply for kids, but they have upped their game. And Becca is correct. Follow them as any of the recommended folks on social media. And our president, the national president, her name is Sue Cressley. She's on fire, and she's on the national news every day saying this is not good for kids. So that's where we find ourselves. I wish there was more to say. Becca's also a great social media presence, by the way. Have you found her on TikTok? Perfect mix of accuracy with a touch of humor. I mean, we all have our coping strategies in this mess, and mine is humor. Not surprising. So please follow Becca on Instagram or TikTok or whatever your platform is. That's one thing I've liked the Academy, AAP, is meeting people where they are now, and they are working with influencers, and they are accepting that many of us people get information about health from TikTok. And they have some statistics on that. And I'm sure you have people among you that are doing that as well. So you may as well be looking at the right, at accurate TikTok. So.
And families look to you, they look to you about so many things, and so I think you don't need to know all the answers. I mean, this is the same thing as us when families ask when, there was a question about hand, foot, mouth that Breena's like, let me double check this, right? So you just need to know what sources to look to refer to, and those exist. So it feels uncertain, but there are good places to go to, and that we feel really good about. So we just want to share those with you because we're sort of all in this together. We know families ask us questions, and sometimes we need to look things up, and they're asking you questions a lot and going off your guidance. I do just want to, I said this already, like the way that RSV immunization changed how sick kids got last year, especially, I just want to say, because it's the kids under one that end up on ventilators with RSV. So these are your kids that you are with all the time. We didn't have a single kid in the PICU we had one who had gotten immunization, and that's it. All the rest of them had not gotten it. And so it totally made our winter so much better for those babies and their families. So it worked so well. And then we can send you the resources to share with families, but it's something that, like, say you've got a 3-month-old, 4-month-old, 5, anyone under 8 months, after October, they should go get that nirsevimab because it's really going to make a difference. And I've said this before, but the classic case is the 1-month-old who's got a 2-year-old in childcare, a 1-month-old coming to the PICU with RSV, and they got it from their 3-year-old sibling in childcare. Like, that's just how it is. So if you've got families who are expecting a baby this winter, they should get protected. It worked so well. So there's some good news there.
All right, thank you both. Should we go back to the pre-submitted questions just to make sure that we had those covered? And I think these were things that John did touch on in his presentation about the 1 and 3 questions, but.
Yeah, and just happy to reiterate, no special protocols for COVID now. Use your same good judgment you use for other illness, and nothing particularly new with the new variant to look out for.
Okay, any follow-up questions from any of those items? I lost my chat. Okay, well, go ahead.
No, I was just going to say, I'm not seeing anything.
Thank you. And the last thing I just wanted to bring to this meeting was something that we have in development with EPI here, and comms obviously has not taken a look at this yet because it is not very eye-catching. I fully understand that. But this is kind of a work in progress for getting a one-stop location for a lot of common reportable illnesses in the early childhood education and school settings. And this is based on a similar sheet shared by our colleagues in Kentucky. So the intention is to be able to pull this up if you have questions about any of these illnesses and be able to get the support you need. The additional resources boxes provide information that isn't specific to individual illnesses. For example, a link to the online reporting tool that Julia kindly shared in the chat. Let me get my laser pointer back here. So that's right here. And we also do highlight the healthychildren.org that Breena was talking about as the top other additional resource category here. And each illness has a link for Vermont-specific information, as well as a link to the CDC's information pages for each illness, which have remained unchanged except for scientific updates over the last few years. We do intend to include a fact sheet for distribution to the family community as a helpful resource for each of these VPDs as well. So I just wanted to get this in front of this group to see if you have any initial thoughts about if this is something that you think you would use, if there are resources that aren't included that you would want to see, understanding again that it's not pretty yet, I know, but just first wanted to ask about that, and also if norovirus is something that would be helpful to include. So that is my just plug to try to get this out for you to take a look at. I think it's okay for us to share all of our slides. So Julia, I can get this out to you unless any of my colleagues let me know I need to revise any of it, but that was just the last item I had to share, and want to thank you all very much for your time and attention today. And if there's anything else any of my colleagues want to say before I stop talking, feel free.
Just answered a fever question. The fever could be a whole topic, by the way, because there is the mechanism by which you check fever, the oral versus armpit versus forehead, that needs a little bit of nuance, but we sort of say 100, 100.4. Interesting. I'm very interested in fever. Remembering, of course, that fever is a good thing because it's the immune response, but our society likes to get those fevers down all the time if the kids are uncomfortable, obviously. The only other thing I wanted to say when Hillary was just talking is the Vermont Department of Health is and always will be a trusted source of information for our world. And so there is no blur there of the confusion among us. And that remains the truth and the North Star. So it's so good to see so many people on here that are available to you as well. And I did want to, our website at the Vermont Department of Health is extraordinary. And Julia has such a fun job on these calls because she just goes link, 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 link. And that's not extra. That's not busy work. That's because everything you ask has an answer on the health department's website. You just have to get nimble. It's much easier to navigate than it used to be. So nimble and having it on your desktop, if you happen to have a computer at work, is always a good strategy.
Do just want to share all links have been recorded and they will be sent out in the meeting materials. So do not feel any pressure to be recording or trying to capture all of those links. Those will be shared. And our last minute, I want to say a very big thank you to Breena, Becca, Hillary, Megan, Katie, and John for your expertise, and Beth for your support and technical assistance. As a reminder, our next call is Thursday, November 17th from 1 to 2 p.m. The registration link for that call will also be included in the meeting materials. And thank you to everyone who took the time to come to the webinar today. In the meantime, please feel free to contact me or Breena and Becca with any health and safety questions and suggestions for future topics. Thank you, everyone.